Let's continue our discussion on face reading. Enteritis is a disease caused by microbial infection from bacteria and viruses. It is a common disease. It can be classified according to the course of the disease in acute enteritis and chronic enteritis. The main symptoms of acute enteritis are nausea, vomiting, and diarrhea. The main symptoms of chronic enteritis are long-term repeated episodes of abdominal pain, diarrhea, and indigestion. Acute enteritis is mostly a result of an improper diet, cold attacking the abdomen, or eating rotten or contaminated food. Chronic enteritis inflammatory diseases. Face reading. The redness of the nostrils ears, which are rosy, shiny, and seborrheic, are signs of acute diarrhea. So here in the illustration, we see a blue tip nose. The therapeutic methods. Patients with enteritis should avoid catching cold and keep the abdomen warm. When attacked by cold, a hot water bottle can be used to warm the abdomen. Control your emotions, adjust your diet, stop smoking, and limit alcohol intake to prevent your stomach from irritation. Dietary advice. Maintain a regular diet and eat more easily digestible foods. Avoid foods that cause gas and upset stomach. Avoid pungent foods and those rich in crude fiber that are indigestible. Exercise. Increase physical exercise to enhance the body's resistance. Choose sports that are suitable to you, such as running, walking, yoga, or ball games. Emotional adjustment. Maintain a good mindset and avoid excessive mental stress. These methods are conducive to keep the disease in check and preventing the recurrence of enteritis. Medicinal diet therapy. Let us look at the lotus leaf and poria cocos porridge. The lotus leaf and poria cocos or fuling porridge. Add 1 piece of lotus leaf, poria cocos 300 grams, 60 grams of short grain rice. Decoct the lotus leaf and remove the residue, but keep the juice. Wash the short grain rice, put into the pot with poria cocos, add the decocted juice to the mix and cook the porridge. This porridge can replenish qi and invigorate the spleen. It is suitable for patients with chronic enteritis caused by a spleen deficiency, and it relieves enteritis-induced diarrhea. Massage. Massage the spleen 15 point or Daheng point, which has the function of removing dampness and dispelling stagnation, regulating qi and invigorating the spleen, clearing the intestines, and regulating the stomach. This is an acupoint mainly for gastrointestinal diseases. Using your thumb to press knead the Daheng point for 3 minutes, 3 times a day. Press knead until you feel the distension. Long-term massaging of this point can help remove intestinal waste and effectively alleviate the symptoms of enteritis. Thank you for your attention.
Interviewing the menstrual cycle. The length of the cycle is ideally 28 days, but it may vary from this norm. The regularity of the cycle is somewhat more important than its absolute value. Thus, if the cycle is consistently of 32 days, this can be deemed normal and would not be considered late periods. Moreover, an occasional deviation from a regular cycle should not be considered abnormal, as the menstrual cycle is influenced by many factors, such as traveling, emotional stress. The following are the main areas of questioning with regard to the cycle. Always early, that is more than 7 days early, Qi deficiency, blood heat, or empty heat in the blood from blood or yin deficiency. Always late, that is more than 7 days late, blood deficiency, stasis of blood or stasis of cold. Irregular, sometimes late, sometimes early, stagnation of liver qi, stasis of liver blood, spleen deficiency, or kidney deficiency. Periods that stop and start, blood stasis. Periods that start or end with a brownish discharge, it's blood stasis. Mid-cycle bleeding, damp heat, especially if there is also some pain, qi deficiency, liver, and kidney yin deficiency. It should be borne in mind that for approximately the first 2 years from menarche, the period's cycle may be somewhat irregular, which is quite normal. Amenorrhea may be due to severe blood deficiency, as often happens in women athletes, blood stasis, or cold in the uterus. So for cycle irregularities, in summary, always early is Q deficiency, blood heat, blood empty heat, liver and kidney deficiency. Always late, blood deficiency, liver blood stasis, cold in the uterus. Irregular, liver G stagnation, liver blood stasis, spleen deficiency, kidney deficiency. Hesitant start is liver blood stasis. Starting or ending with brownish discharge, liver blood stasis, and mid-cycle bleeding, dump heat, G deficiency, liver and kidney deficiency. Thank you for your attention.
Let's continue our discussion on hand tying lung meridian, the UMN or the cloud gate. The hand tying lung meridian, as seen in the photograph, to locate lung 2 on the anterior thoracic region in the depression of the infraclavicular fossa, medial to the coracoid process of the scapula, 6 tune lateral to the anterior median line. This is lung 2. Lung 2 or Yuanmen cloud gate, or also called the cloud door. The upper jaw is a place of mist. The lung in the upper jaw is amongst the mist clouds of heaven. Cloud gate is the highest point on the lung meridian. From here, the chi starts its descent. Cloud gate doesn't possess the same invigorating attributes of lung 1. It is more about the ensuring the free communication with the chi of heaven, maintaining balance, and having an overview. The lung, in order to distribute the influence of heaven, controls the waterways and keeps the rhythms of our automated processes correct, must be clear and fresh. When this is not the case, the lung feels oppressed with a heavy sadness in the chest. This can feel isolating, as if disconnected from the inspiration of heaven. The path ahead is clouded and obscured, and the cycle of meridian chi is already disturbed. If someone experiences a gulf dividing them from the rest of life, they may appear detached, remote, superior, or vague. Cloud gate dispels oppression and allows one to feel reconnected with the influx of the heavens and the rhythmic processes of life. Needling cloud gate enables the lung to fulfill its office of regulating and descending the chi, so inspiration can be clear. At the level of the mind and spirit, this allows the clouds of the upper jaw to part and the radiance of life to be revealed. When thought processes are turgid, cloudy, stuck, or rigid, or there is a lack of insight about feelings and sensations, this point can bring clarity. If there is sense of disconnection, disappointment, or deprivation, cloud gate can simulate the descending of the lung chi and encourage one to breathe fully and freely, allowing for the possibility of receiving more. One of the ways imbalance in the lung can manifest is through the pose attachment to the material world, wanting more and more to compensate for the impeded connection with the heavens or lack of quality within. With the pose influence is disturbed, our instinctive responses can be overly sensitive to changes in environment, or we may feel that life is always happening over there, anywhere but where the person is. Cloud gate can settle the spirit and the endless restless quest of the lung for connection and quality. Indications: this is for oppression, feeling lost or dissatisfied. Used to stimulate lung qi, regulates lung qi, and stops cough, clears lung heat. Used for channel problems and pain in shoulder and chest area. So we use lung 2 when a person feels like they are living under a cloud and having lost connection to their heavenly aspect. This is particularly relevant following extended periods of grief, depression, or sadness. Consider if the patient feels disconnected, cut off, or living a meaningless existence. This point reconnects them to the rhythms and cycles of life, Can be used with lung aid, particularly in the autumn. Helpful for general chest problems such as coughing or asthma. Thank you for your attention.
Differential diagnosis for Western and Chinese medicine for lower back pain. Let's start with the Chinese differentiation, the Western differentiation rather, for lower back pain. Lower back pain stemming from musculoskeletal origin, muscle spasm, muscles remain contracted, lack of mobility, disc degeneration, chronic backache, acute episodes, pain down the buttocks, legs, feet, stiffness, ruptured or herniated disc, severe low backache extending down the buttocks, legs, and feet, tingling, numbness in the legs, feet, muscle weakness, spasm. Spinal stenosis, there will be backache, numbness, weakness down the buttocks, thighs, lower calves after standing or walking for some minutes. Spine curvatures, scoliosis, injury to muscle or ligaments supporting back, fractures to spine from osteoporosis, arthritis, localized stiffness, pain, redness, warts, and morning, fibromyalgia, multiple tender areas or aches, fatigue, sleep disturbance. Now we go, okay, this is still from Western differentiation of lower back pain stemming from organ pathology. Bladder infection with pressure in the lower pelvis, painful urination, frequent urgent cloudy urine, blood in urine. Kidney stone with flank pain, nausea, vomiting, frequent urgent painful hesitant urination, abdominal pain, fever, chills. If it's endometriosis, there will be pelvic cramps, dysmenorrhea, pain on sexual intercourse, premenstrual spotting, infertility. If it's ovarian cancer, the lower back pain, the backache will worsen over time, pelvic heaviness, vaginal bleeding, abnormal menstrual cycle, GI symptoms. Ovarian cysts with constant dull pelvic pain, painful intercourse, abnormal uterine bleeding, abdominal bloating or distension. Other causes include pregnancy, poor posture, secondary cancer in the spine. Now let's go to the Chinese differentiation of lower back pain. Diagnostic questioning according to nature of pain. So if it's acute pain, this is external pathogen invading or blood stasis. Chronic pain, kidney deficiency, spleen qi deficiency with dump obstruction. Heavy pain worse in the morning, that's called dampness. Dull pain, slight stiffness, a feeling of cold, kidney yang deficiency. Sharp, stabbing, fixed pain, severe stiffness, liver blood stasis. Vague, movable, variable pain, stagnation of liver qi. Diagnostic question according to aggravation and amelioration. Worse for cold, damp weather, that's called damp. Worse for stress, stagnation of liver qi. If the lower back pain is worse for movement, this deficiency pattern, blood stasis. Worse after sex, kidney deficiency. Lower back pain that is worse in the morning, spleen qi deficiency with damp obstruction. If it's worse in the afternoon or evening, damp heat. Better for rest, kidney deficiency. Better for exercise, stagnation of liver qi, spleen qi deficiency with damp obstruction. Better for heat, that's cold or cold damp, kidney yang deficiency. Distal points for acute and chronic pain. So you are going to press this point to diagnose. Bladder 60, so that's low back neck pain. Bladder 58, chronic pain. Bladder 59, bladder 36, bladder 37, bladder channel. Gallbladder 30, buttock pain and or sciatica. GB 31, 34, 39, gallbladder channel. SI3, bladder 62. Etiology in Chinese medicine for lower back pain is excessive physical work, excessive sexual activity, pregnancy, childbirth, invasion of cold, damp, overwork, sedentary lifestyle. Zhangfu patterns, excess, wind cold invading the channels, damp or damp heat, stagnation of liver qi, stagnation of qi or blood stasis, and deficiency patterns are kidney deficiency and spleen qi deficiency. Thank you for your attention.
Let's talk about the concept, formation, Physiological actions of qi. Essence, qi, blood, and body fluids are among the basic substances that constitute the human body. They are also the basic substances for maintaining its vital activities, and in turn, they are the products of metabolism by the viscera. Both physiologically and pathologically, there is a reciprocal causal relationship between essence, qi, blood, and body fluids on the one hand, and the viscera, tissues, and the meridians on the other. Consequently, they are of major importance in guiding the clinical analysis of symptoms and therapeutics. The concept of qi. In ancient China, qi represented a simple understanding of natural phenomena. Already during the spring, autumn, and the warring stages, philosophers held that qi was the most basic substance that constituted the world and that everything in the world was produced by the action of qi. This conception was introduced into medical theory and became a fundamental tenet for explaining the vital activities of the human body. Today, qi is conceived as the most basic substance that constitute the human body and maintain its vital activities. In order to sustain the vital activities, the body needs to extract nutritive substances from the environment to replenish qi in the zhang viscera. Without qi, this viscera would simply cease to function. Now, the formation of qi. The formation of qi is a very involved process in which a number of zhangfu viscera play important parts. Qi in the human body comes from three sources. Innate essential qi is inherited from the parents. Essential qi is derived from the essence of drink and food, transported and transformed by the spleen and stomach. And clear qi or fresh air is inhaled by the lungs from the natural world. From the previous chapters, it is clear that the formation of qi is not only related to innate inheritance, acquired nutrition, and condition of the environment, but also closely to the kidney, the spleen, the stomach, and the lung. When the functions of these internal organs are normal, qi in the body is replete. Conversely, if they function abnormally, the actions of qi will be affected, and pathological changes such as qi deficiency may ensue. The physiological actions of qi. Qi is the basis for the maintenance of the body's vital activities. It has many different actions. In general, these actions may be grouped in the following 5 categories. 1. Promoting action. Qi belongs to yang and is full of vigor. It can propel the circulation of blood and the distribution and metabolism of body fluids. Simultaneously, it can also stimulate the physiological functions of the zhangfu viscera and the meridians, so that the viscera can continue to produce new qi, blood, and body fluids to meet the needs of growth and development of the body. Any reduction in this motive force of qi can lead to diminished function of the zhangfu viscera, resulting in disordered and uneven blood circulation or disordered water metabolism. 2. Its warming action. This refers mainly to the warming and evaporative actions of the yang qi, maintenance of the body normal temperature, the physiological activities of all the organs and tissues, and the normal movement of blood and fluids all depend upon qi's warming action. Deficiency of qi, especially yang qi, will lead not only to such cold symptoms as cold aversion, preference for warmth, cold limbs, and low body temperature, but also to slower blood circulation and disturbances of fluid metabolism. The third, defending its action. This action is demonstrated mainly in 2 aspects. One is to defend the body surface against attacks of exogenous evils. The other is to combat exogenous evils that have penetrated the body defenses and to expel them from the body. When the defending action of the body is strong, the person is less likely to suffer from illnesses. And should the person become ill, the illnesses is more readily treated. But if the defensive capacity is weakened, the body is more susceptible to attack by pathogenic evils, and any illnesses is more difficult to treat. The fourth, stabilizing action. By this function, qi stabilizes the liquid systems of the body, preventing liquids from flowing out of their vessels without cause. It is marked by the actions of keeping the blood flowing in the vessels and of controlling the amount of secretion or excretion of sweat, urine, saliva, gastric juice, intestinal juices, and semen, so as to prevent their abnormal loss. Failure to control blood flow in the vessels may result in bleeding. Failure to control body fluids may cause spontaneous perspiration, polyuria, or excessive salivation. Failure to stabilize sperm may lead to spermatoria or premature ejaculation. By dysfunction, she also maintains the internal organs in their designated locations. Failure in this action may lead to their ptosis or prolapse. And the fifth, it's Chi's transforming action. This refers to the various kinds of changes in the body induced by the movement of Chi. Mostly, it encompasses such actions as the metabolism of essence, blood, and body fluids, and their transformation into one another. For example, essential substances are extracted from food and drink, and these are transformed into essential Chi. Essential Chi, in turn, is transformed into Chi, blood, or fluids. Metabolism of the fluids further transform them into sweat or urine and the wastes. These are all effects of the transforming action of qi. If this function is disturbed, it may affect the turnover of qi and blood and the metabolism of body fluids, the digestion of food and drink, the absorption of essential nutrients from them, the excretion of sweat and urine, and the defecation of feces. Disturbances in these processes can result in many kinds of illnesses. Thank you for your attention.
Diagnosis according to Zhang organ patterns, kidney Jing deficiency. Kidney Jing is an aspect of kidney yin, but it is also a distinct imbalance with specific symptoms and signs. Because kidney Jing is such a fundamental and basic aspect of the body's constitution and is in part a form of qi that is inherited from the parents, a Jing deficiency condition is an imbalance that is difficult to rectify. Some believe that you cannot replenish deficient Jing, only improve the quality of remaining Jing. Kidney Jing is partially inherited from the parents. This means that their age and health at the time of conception have crucial implications for the quality of a person's Jing. Jing can also be weakened by chronic diseases, chronic stress, mental and physical overexertion, excessive sex, births, pregnancies, and old age. Symptoms and signs: frail constitution, weak teeth, porous or fragile bones, slender or thin body, mental or physical underdevelopment in children, deafness, tinnitus, dizziness, poor memory, delayed or absent development of secondary sexual characteristics in puberty, prematurely gray or white hair, infertility, lumbar weakness, weak knees, amenorrhea, poor concentration, weakened mental capacity, hollow, depressed area in the root of the tongue, weak pulse in the sure positions. His symptoms: frail constitution, weak teeth and bones, infertility, depressed area on the root of the tongue. Treatment principle: nourish the kidney Jing. Acupuncture points, we can choose from kidney 3, 6, 13, REN 4, bladder 23, bladder 52, 11, and GB 39. Needle technique is tonifying. Kidney 3, 6, REN 4, bladder 23, and 52 tonify kidney Jing, bladder 11, and GB 39 tonify the bones. A person who is kidney Jing deficient must ensure that they get enough rest and relaxation, and they should not drive themselves too hard mentally or physically. Men who are Jing deficient should avoid having too much sex. Pregnancy and childbirth will further weaken the Jing in a woman who is Jing deficient. They should avoid stimulants, especially coffee and caffeine. Foods that are attributed Jing nourishing qualities are royal jelly, eggs, roe or caviar, seeds, nuts, propolis or pollen, bone marrow, brain, kidney, oysters, seaweed and algae, artichokes, raw milk, nettles, and oats. Kidney Jing deficiency can be caused by kidney yin deficiency, kidney yang deficiency, qi deficiency, and blood deficiency, and can result in kidney yin deficiency, kidney yang deficiency, qi deficiency, and blood deficiency. To summarize, kidney essence or Jing deficiency: etiology, long chronic illness, overwork over long period, poor development at the fetal stage. Accompanying pathology: kidney yin deficiency, kidney yang deficiency. Signs and symptoms: impairment of intellectual function, osteodystrophy or poorly developed bone structure, dizziness, tinnitus, weak aching back and knees, infertility, impotence or lack of libido, loss of head hair or premature graying, loosening of teeth. In children, retarded growth and development, short stature, sluggishness of physical movement, low intelligence, weak bones, retarded closure of fontanelles. In adults, premature senility, weakness of legs, difficulty in walking, dullness of spirit, slowness of physical movement. Pulse, floating, fine, empty leather. Tongue, red without coating or pale. Treatment principles, supplement kidney essence, bone marrow, kidney yang, enrich kidney yin. Acupuncture treatment, bladder 23, 52, kidney 3, spleen 6, GB 39, needle with supplementation. Select further points according to symptom. For dizziness, do 20 and 16. Tinnitus, SJ 17, GB 2 and SJ 3. Lumbar pain, do 3, bladder 40 and 60. Seminal emission, kidney 12, REN 6, heart 7, stomach 36. Thank you for your attention.
Let's talk about the balance of yin and yang, the mutual repellency of yin and yang. Among the conditions of imbalance of yin-yang mutual repellency is distinctive. There are two varieties, excessive yin repelling yang and excessive yang repelling yin. The principal cause of this repellency is extreme excess of one, causing blockage and exclusion of the other, so that all relationship between two is severed. Clinically, this has two complex patterns of manifestation: true cold with false heat and true heat with false cold. The excessive yin repelling yang. There are two patterns. In one, excessive yin occupies the interior and repels yang to the exterior. Since yang is alone in the exterior, clinically there are heat-type symptoms in the exterior, such as fever, flushed complexion, thirst, and a large pulse. Because the basic pathology is yin-cold excess in the interior, which forces yang to the exterior, this is a case of true cold and false heat. In the other pattern, excessive yin occupies the lower half of the body and repels yang to the upper half. Clinically, this usually presents true cold symptoms in the lower body and false heat symptoms in the upper. Now, excessive yang repelling yin. In this case, excessive yang occupies the interior of the body and repels yin to the exterior. Clinically, in addition to internal heat symptoms, there are cold type symptoms in the exterior, such as cold limbs and sunken pulse. Because of the basic pathology is yang heat excess in the interior, which forces yin to the exterior. This is a case of true heat and false cold. It is also known as paradoxical cold limbs due to yang, or paradoxical cold limbs due to heat. Thank you for your attention.
Enuresis and incontinence, we discussed the pattern kidney yin deficiency. Clinical manifestations, incontinence of urine but in scanty amounts, dribbling after urination, dark urine, dry throat, dizziness, tinnitus, night sweating, insomnia. Tongue without coating. If there is empty heat, the body is red. Pulse, floating empty. Treatment principle, tonify the kidneys and nourish yin. Points, REN 4, kidney 3, spleen 6, bladder 23, 28, lung 7, and kidney 6. Reinforcing method, no moxa. REN 4, kidney 3, and spleen 6, nourish kidney yin. Bladder 23 and bladder 28, tonify kidney qi and strengthen the bladder function. Points in the back are used as, although there is a deficiency of yin, it is still necessary to tonify the yang within the yin to control fluids. Lung 7 and kidney 6 in combination regulate the renmai, or the directing vessel, and nourish the yin. Case history. A 65-year-old woman had been suffering from slight incontinence of urine for several years. 6 years previously, she had an operation to correct a prolapse of the bladder, but it did not help the incontinence problem. Her urinary problem was quite complex in that she suffered from a slight incontinence but also from frequent urination, frequent urinary infections with burning on urination, and difficulty in urination or dysuria. 5 years previously, she had an operation to stretch the urethra, but this did not help any of her symptoms. During the last 2 urinary infections, she also had blood in the urine. This patient also felt exhausted all the time and suffered from lower backache and dizziness. Her pulse was very weak and deep, and her tongue was red and slightly without coating. In terms of Chinese disease, Tianping identification of the disease, this pertains to both blood urinary syndrome and incontinence of urine. In terms of patterns, there are various patterns. Firstly, the incontinence of urine is due to sinking of spleen and kidney qi. Unusually, this occurs against a background of kidney yin deficiency, which is evident from the lack of coating on the tongue. Usually, sinking of kidney qi is associated with kidney yang deficiency. In addition, the yin deficiency has given rise to empty heat, as evidenced by the redness of the tongue. The empty heat causes the blood urinary syndrome. Thank you for your attention.